Avery Bellinger, and I'm going to be doing the NU311 medication administration checkoff, and I'm in section 110. Here's the scan. All right. So while I'm in the med room, I'm going to keep the door closed, limit distractions. I won't answer the phone. And if I do have to talk to a colleague, it's going to be only important, essential information. And I'm going to follow my agency's no interruption policy. The first thing I'm going to do is compare the order form and the MAR. So I see the name is Jaguar J. Jones, Jaguar J. Jones. The medical record number is 4176352, 4176352. The medication I'll be administering is heparin, 5,000 units, 5,000 units, subcutaneously, every 12 hours. There's no indication listed, but I would administer heparin because it's an anticoagulant, so it stops the blood from clotting, and all elements of a legal prescription are present. And I do see that he is allergic to penicillin on both the order form and the MAR. So I'm going to move the order form to the side and look at my MAR. Before I start my first check of the 7 rights of medication administration, I'm going to wash my hands. All right, so I see Jaguar J. Jones. Medical record number is 4176352. The medication I'll be administering is heparin. So I'm going to grab the heparin. And the expiration date on it is December 5th, 2025, so it's not expired. And the route I'll be using is subcutaneously, so I'm going to grab a TB syringe. And it is 5,000 units. So since this vial says 10,000 units per milliliter, I'll be administering 0.5 milliliters. And anytime I do math, I'll get another nurse to check it. I'm going to clean the top of this vial. Take out the syringe. And I'm going to fill the syringe with 0.5 milliliters of air. And then I will insert that into the vial. I'm going to insert that air. And I will draw back to 0.5 milliliters of the heparin. I'm going to do it slowly. And I'm going to do a little bit more than 0.5 milliliters just so I can get all the air bubbles out. And I'm going to put the safety up, and that is 0.5. Going to lay that down. And the time is every 12 hours. The indication would be because it's an anticoagulant, and all elements of a legal prescription are present. That ends my first check of the 7 rights of medication administration. So now I'm going to start my second check. So the name is Jaguar J. Jones. The medical record number is 4176352. The medication is heparin, and I have heparin here. Heparin. And it is 5,000 units. So this says 10,000 units per milliliter. So I have 0.5 milliliters in my syringe. It is subcutaneous, so I'm using a TB syringe. And it is every 12 hours. He has not had it in the past 12 hours, so he can have it. And the indication is not listed here, but it is an anticoagulant, and all elements of a legal prescription are present. So now I'm going to make a label. And on this label, I'm going to put the patient's name, which is Jaguar J. Jones. The medication, which is heparin. And and it is 5,000 units. And this says 10,000 units per milliliter, and I have 0.5 milliliters, so 5,000 units. And I'm going to place this at the bottom of my syringe. So now I'm going to take my materials, my MAR, my vial, and my syringe into my patient's room. Okay. And once I get in here, I'm going to perform hand hygiene. And I'm going to raise the bed, lower the side rails. I'm going to position my patient comfortably, and I'm going to explain the procedure. So today I'm going to be administering heparin subcutaneously. Oh, I guess so. His arms just turned around. Subcutaneously. All right. So I'm going to begin my third check of the 7 rights of medication administration. So I'm going to check his name, which is Jaguar J. Jones. Jaguar J. Jones. The medical record number is 4176352. 4176352. I do see that he is allergic to penicillin, both on the MAR and the bracelets. I see that you're allergic to penicillin, Mr. Jones. Are you allergic to anything else that you're aware of? No? Okay. I'm going to move on. It is heparin that I'm administering. And I see heparin on the vial, heparin on the syringe label, 5,000 units, which I have 10,000 units per milliliter. So that will be 0.5 milliliters. And I have that here. And I have 5,000 units labeled. It's subcutaneously, and I'm using a TV syringe. It is every 12 hours, which he hasn't had it in the last 12 hours, so he can have it. The indication for the medication would be it's an anticoagulant to stop his blood from clotting. And all elements of a legal prescription are present. So next what I'm going to do is put my goggles and my clean gloves on. I'm going to take this alcohol swab, and I just turned his arm, but it would be that outer aspect of his upper arm around the midpoint. It's going to be 3 fingers below the deltoid insertion, 3 fingers above the elbow. I'm going to open this alcohol, and I'll start from the middle and clean outward, not crossing over what I've already cleaned. And then I will put the alcohol swab on top to point to where I've already cleaned. Next, I'm going to take the medication. I'm going to pull back on the safety, hold it like a dart. And since this is subcutaneous, I'm going to pinch his tissue. Since I can pinch about an inch, then I will insert this needle at a 45-degree angle. I'm going to hold down on that pinch, take out the needle, put it straight into my sharps container, and I'm going to take this alcohol swab and gently press on it. I'm not going to massage, and I did not aspirate. All right. Then I'll position the patient back comfortably. I'm going to lower the bed and raise the side rails back. I'm going to take off my gloves, throw those away, and perform hand hygiene. I'm going to take off my goggles. And I'm going to observe him for any allergic reactions. When I document, I'll document where I did the injection, what I injected, so the heparin, what time I did it, and I would I would chart how he tolerated it, if there was any relief from the medication, if it's working, and I'll follow back up with the patient. I'll go visit him as indicated.